Hello all, welcome to HFMA's 2021 Revenue Cycle Conference. We're so glad you all could join us virtually. My name is Dara Satija, Senior Manager at Deloitte. I'll be one of your speakers for today's session on Revenue Cycle Compliance Leading Practices, where we will focus on discussing how data analytics can assist organizations in responding to the present and preparing for the future. My co-speaker is Debbie Netter, Chief Compliance Officer for the UMass Memorial Healthcare Revenue Cycle and UMass Memorial Medical Group. Today's session will focus on discussing business imperative for transforming your compliance program into a proactive, data-driven, and risk-intelligent organization, use cases for data analytics in compliance to help reduce revenue loss and support quality. And then finally, we will also talk about what are the considerations you need to take for path forward, especially when it comes to operationalizing compliance data analytics. After this presentation, you should be able to understand ways to transfer your revenue cycle compliance program using data-driven approaches, learn leading practices of revenue cycle compliance auditing and monitoring practices, leverage learning from the case studies and tools discussed to tailor an approach that meets your organization's need. As we all know, right, more than ever before, organizations are in the need of transforming ways data is utilized, both internally and externally, to perform compliance risk monitoring. A well-defined, risk-based, data-driven vision and approach can help modernize your program and increase risk intelligence. Amidst managing cost, resources, regulatory audit pressures, recent COVID pandemic, and many other things that are going on, creating new business insights and demonstrating tangible value is critical. We all have heard about the DOJ guidance, especially the June 2020 updates that came through. And you see there are many, many areas that DOJ is focused on. For an organization to be able to demonstrate effectiveness, both DOJ and SEC states that it should take time to review and test its control. The DOJ guidance, especially in the evaluation of corporate compliance program, is more detailed and emphasizes access to and use of data for monitoring, testing, and assessing effectiveness. For example, the DOJ now asks for the first time whether compliance and control personnel have sufficient direct or indirect access to relevant sources of data to allow for timely and effective monitoring and/or testing of policies, controls, and transactions. DOJ is not only concerned with access to data, but also with how data is used in compliance activities, such as assessing the effectiveness of control, training, monitoring, assessments that are related to investigations, and more. Additionally, DOJ will now assess whether compliance and control personnel face impediments that limit access to relevant sources of data. And if so, what is the company doing to address those impediments? This could potentially pose issues for many organizations that divide oversight and control responsibilities among various groups, such as compliance, legal, procurement, finance, and others. To address this issue, we have seen organizations take steps to break down those silos among those groups and others related, particularly those that limit effective use of relevant data for testing, monitoring, and program improvements, and to foster appropriate data access and sharing with compliance and relevant control personnel. As we break down each of the DOJ focus areas listed on this slide and related implications, we see that there are many practices that are applicable here and great importance of data. So as we talk about data analytics, we're not just talking about just a point in time analysis. We're talking about something that's ongoing, that's sustainable. So in this presentation, we'll reference many of the practices that are listed per focus area. And as always, we recommend you think through what's applicable to your organization, prioritize the practices that are being discussed during this presentation, and tailor to meet your needs. And with that, Debbie, I'll turn it over to you to see if you can chime in on, anything you would like to add.
Sure. Thank you, Dara. The DOJ guidance gives you some ideas. In your organization, you can look at things to monitor, such as even tracking the intranet, your internal website, for access to compliance policies or the code of ethics and business conduct, or compliance program topics. Just checking what your workforce members are looking at on your intranet is an indicator of what program topics are of interest. See what those workforce members are accessing, viewing, how frequent. You can even drill it down to which areas, departments that may spend a lot of time on your web pages. That type of access, along with information, is very telling. It might even guide you in what educational programs you wish to provide. Other things to track might be not just the issues. A lot of people focus on issues, but include your corrective actions and your discipline. Maybe make sure that you're applying consistent corrective action across the board, and how effective has it been. Those are just a few. I know we're going to get into a lot more detail shortly. So on the next slide, we have information from the Healthcare Fraud and Abuse Control Program. Their goals are to coordinate federal, state, and local law enforcement efforts relating to healthcare fraud and abuse by conducting investigations, audits, inspections, and evaluations relating to the delivery of and payment for healthcare in the United States. This program issues an annual report and showing year-over-year fraud, abuse, and trends. It's a great place to start. We have highlighted a few important stats from fiscal year 18 and 2019 reports. As you can see, in fiscal year 2018, the federal government won or negotiated over $2.3 billion in healthcare fraud judgments and settlements, and $2.6 billion in fiscal year 2019. In 2018, $2.3 billion was returned to the federal government or paid to private persons, while $3.6 billion in fiscal year 2019. With that, in fiscal year 2018, $2.3 billion attributed to the Medicare trust funds received transfers of approximately $1.2 billion, in addition to $232 million in federal Medicaid money. And the equivalent in 2019 received transfers of $2.5 billion, with $148.6 billion in federal Medicaid monies. We have included the link at the bottom to the report for your reference. You can go look. It's a great source to the government's areas of interest. You'll see a lot of information such as focus on telemedicine, durable medical equipment, genetic testing, opioid billing, and prescribing, just to name a few. And here on our next slide, there's some trends in Medicare payment error rate. So CMS attributes the decreased improper payment rate and payment to reductions in home health, other Medicare Part B services, and durable medical equipment, prosthetics, orthotics, and supplies. Specific actions taken to reduce improper payments include policy clarification and a change to a targeted probe and educate effort, such as with the home health agencies. For other Medicare Part B services, they focused on clarification and simplification of documentation requirements under the Patients Over Paperwork initiative. And then there's various corrective actions taken by Center of Medicare and Medicaid Services, CMS. And then in fiscal year 2018, CMS reported an actual payment estimate of 8.1%, which equates to $15.6 billion. The submission of more accurate diagnosis by organizations, they feel, drove the decrease from the prior year's estimate of 8.3%. Also, the percentage of improper payments made under the Part D prescription drug program in fiscal year 2018, CMS met its target of 1.66%, reporting an actual improper payment estimate of the same, which equates to $1.32 billion. Submission of more accurate payment data by Part D sponsors primarily drove the decrease from the prior year's estimate. Lastly, while the factors contributing to improper payment in the Medicare fee-for-service program are complex and vary from year to year, the primary causes of improper payments continue to be insufficient documentation and medical necessity errors. CMS believes implementing the targeted corrective actions will continue to prevent and reduce improper payments in these areas and reduce the overall improper payment error rate. So now we'll move on to our first polling question. Does your organization use data analytics to analyze compliance risks and or assist with monitoring? It's yes or no.
Thank you, Debbie. I hope everyone had a chance to answer the polling question. We'll give it a couple more seconds. And with that, we'll move to our next slide. So let's talk about some use cases of data analytics, right? There's one to talk about in theory. One is how can I practically apply that within my program? As previously discussed, risk intelligent, data-driven approach requires a vision. It is critical to define your vision and priorities, as various forms of analytics can be utilized to help reduce revenue loss, support quality, increase compliance effectiveness, risk sensing, and much more. In today's presentation, we'll talk through 5 examples where we will outline the purpose of the analysis, suggested approach, examples of sources that can be utilized, along with example outcomes and illustratives. Additional use cases are included in the appendix for your review and considerations. I'm sure we've all heard all data is not created equal. Hence, it is important to consider all appropriate sources of data, both internal and external to your organization. Using an approach of analyzing and modeling both internally available data and externally sourced data will allow you to have greater insights and position you to take data-driven informed decisions. Some examples of internal data sources that we are all, I'm sure, familiar with are revenue, coding, and billing data, patient accounting and claims data, clinical documentation and quality data. Some examples of external data sources are listed on this slide and the next slide that include hospital compare data, health grade information, Leapfrog. There's OIG Newsroom, reports and investigations performed by OIG. There's CMS data that's available, including even your regional recovery audit programs. Pepper report that you all should have access to, data available from your Medicare contractor, your MAC, and there's many other sources when it comes to benchmarking, doing trends, patterns. Once again, we recommend you look within your organization to say what data is already available externally and what would you like to have access to, depending on, again, what's your vision and what are you trying to accomplish. So with that, we'll move to our second polling question. What type of data do you most utilize within your organization? Internal data sources, external data sources, or both? We'll give a couple more seconds. And the next few slides, along with additional use cases that are in the appendix, will provide great examples of how different data can be analyzed for, not just getting insights, but then also developing strategic, actionable goals. So with that, Debbie, I'll turn it over to you for our first use case scenario.
Thank you. So our first case is on professional coding. On the professional side, we use data analysis to identify outliers and patterns with our providers. We look at CPT coding trends per provider and by specialty, CPT code usage, and compare internally as well as externally to national averages and peers in the same specialty. You can utilize internal data and benchmark this information against external data, such as some of the things that Dara just mentioned, things like the CMS provider utilization and payment data public use files, and other individual reports available from your Medicare administrative contractor, your MAC. CMS and other third-party payers are already doing something similar. They utilize what you might know of as a comparative billing report. So they're already looking at this and providing information out to organizations. But you can do this internally. So you can identify target areas for investigation based on your internal and external benchmarking. You can target specialties, providers, CPT codes to review for upcoding or downcoding, modifier usage, incorrect coding. Some examples in your materials include evaluation management code volumes, you'll see in the upper right grid, by physician. And the second table in the lower right shows benchmarking providers for modifier 25 use, another hot topic. And once you've identified outliers or target areas, you always want to move to a focused chart review of targeted CPTs and providers to determine if clinical documentation can support the code build. You always want to validate your information. Now handing over to you, Dara, on our next use case.
All right. So like professional coding, hospital coding analysis can also assist with identifying outliers, trends, pattern in both outpatient and inpatient claims. Some examples of analysis highlighted here focus on identifying outlier stays, comparing your inpatient claims data to thresholds by top 10 DRGs, average length of stay, and geometric means length of stay. In the example shown at the bottom of the slide, you can see that trends vary by DRG. It is important to analyze both at the aggregate level and at DRG specific level, because root causes may be different, and based on your organization, some may be more acceptable trends than the others. Once analysis is performed and trend pattern is observed, a tailored analytic assessment, similar to what Debbie spoke about, can be initiated with a small probe of inpatient and outpatient medical record. And this is where I think, you can go random, you can go judgmental, you can, pick samples that give you double clicks on the trends that you saw at a higher level, or you can, diversify your sample. Basically, there are many ways that you can go about it. These reviews can be further targeted by analyzing the Pepper report, core quality measure data that you have, results from the performance related to that specific program or department, knowledge of the industry risk areas. As we talked about, OIG has a list of their focus areas, what's top of their mind. You may have something recent from your MAC as to what they're focusing on, what are some recent audits you've had. So you can further utilize those external data points to inform what your probe needs to focus on. So it's not just a siloed view once again. And again, if there have been any coding or billing audits or investigation in the area that you're looking into, that can further inform your strategy and your approach. As always, be sure to validate the data prior to analyzing. I'm sure we all know from using our hospital professional or any data that's available that it's not always clean. And it can be difficult to go through the validation process, but that time and energy, both Debbie and I will say, is absolutely worth it. And it does pay off at the end when you're really trying to pull out meaningful insights. Always think before just using traditional Excel tools. Excel is fabulous, but at the same time, it does have its limitations. And sometimes complex data can be better managed with Access, Tableau, many other tools that I'm sure your organization may have access to. So once again, do your research to say what's available within your organization so you can best utilize it to perform the analysis. Because this is, again, not just one time. We recommend you have a sustainable, repeatable process. Be sure to set up the process appropriately and accurately from the start. So not only can you repeat it, but you can also be flexible with it. Make sure that you can adjust your parameters as required, because as we all know, risk areas don't always remain the same. Errors do change. There are different issues that come up. So we want to make sure that there is that flexibility built into the process. And we'll talk more about that later as well. And finally, data is only good as how it's presented and in what manner. So develop clear dashboards to summarize and report results. It should be in a manner that's understood by more than just compliance professionals. So with that, Debbie, turning over to you.
Thank you. We'll now move to drug unit billing as one of the topics. Using data analytics to identify drug waste and overspending by drug type and department is very helpful. One example is to calculate total unit per drug by using billing units per package and number of packages used per dose. You can compare billing amounts to the billable units to identify cases of waste, looking for cases where billing amounts exceed billable units. Benchmarking of internal statistics to CMS data is also very helpful and beneficial. Medicare Part B drug spending dashboards provides average spending per dosage unit and change in average spending per dosage unit over time. Since the quantity of a drug dosage unit is the same as the quantity of the drug in a HCFAC billing unit, comparison of spending can be performed to analyze wastage and opportunities for operational improvements. An example that we added here on the right was to trend the drug spend and waste over time. We have listed a number of drugs and related spending and pricing information, just to give you an idea. If you look at the one kind of underscored, Neulasta, in the list, you can see the average spending per dosage unit in 2015 was about $3,500, and in 2016, almost $3,900, an 8.9% increase in average spending. for a total spend in 2016 of $1.3 billion. In the bottom right-hand corner, you can see an increased spend over time from 2012 to 2016, and the last, it was a dramatic increase. Other things to consider with on your drug side, think about manufacturer overfill. So some manufacturers overfill the bag or the dose, and you want to make sure you're appropriately billing. Other things really highlighted with our task force, remember the fraud and abuse program we were talking about earlier, they are looking at providers' prescribing patterns, especially around opioids. Is the provider working to wean their patients off opioids, or are they continuing or increasing? These are things that you can do internally, looking at prescription volumes and habits per patient, by provider, etc. So increases in patient populations or same patients with increased patient visits and prescriptions. These are just a few ideas that you can look at. And now handing over to you, Dara, for high-risk DRG.
Thank you, Debbie. So high-risk DRGs, we're talking about identifying DRGs by services, by physicians, service area, focusing on utilizing CMS's comprehensive error rates data, CERT, in addition to your internal inpatient data. So this is where we're combining internal data available to the externally sourced data and performing an analysis of the current claims volume to the top 20 service types. And you can do top 10, you can do top 20. The goal here is to benchmark against average length of stay, public Medicare data, and identify, are there any suspect claims that may be picked up by CMS? Are there any trends and patterns that we're noticing? The claims that can be reviewed once again against medical record documentation. We want to make sure that the documentation substantiates the services that are billed, that the review is focused on looking for not only the supporting documentation, but also identifying any gaps that may exist. Are there any corrective actions that can be utilized to prevent similar type of errors in the future, or denials that may be caused? And what you see on your screen, when you set up not just the one-time comparison benchmarking data, but when you set up an ongoing monitoring, you can see what areas you need to focus on. And each analysis that you look at, whether it's by service area or by DRG, you will see the root cause may differ, right? So when it comes to breaking down the analysis by root cause, it further helps in developing a remediation plan and making sure that part of that remediation plan, you have appropriate education and process improvement steps also embedded. And again, there may be some peaks that demonstrate error rates are above national average. There are some that may be well below. And once again, take a look at your organization, your area, your region, and see how it compares. As always, trends can be explained by a variety of reasons. And all we're trying to emphasize here, as we did in the prior examples, is to say, use this as a starting tool to use the benchmarking results to then further tailor your next step, which is usually the small probe sampling. And as always, it's important for any reviews you do, whether it's a probe sample or further, that the documentation in totality does adequately support coding and billing of the services. So with that, we'll move to our final example for this presentation, which is for telehealth claims.
Yes, telehealth is seeing a tremendous increase in its use, especially during the public health emergency. So with that, we'll bring higher intensity of scrutiny from the payers. Using data analysis to identify high-risk billing patterns by CPT, volume, modifier usage, place of service, and providers will be very beneficial. Aggregate billing data by CBT and convert to total time per provider is one strategy. Identify providers billing more than 24 hours, for example, or probably a lesser threshold would be more appropriate. You can work with compliance to identify what an appropriate threshold will be. To identify abnormal billing patterns. Check for abnormal billing patterns and correct application of modifiers or place of service. So once again, though, confirm your findings through medical record review to verify services are documented and support the code billed. Just don't rely on the data. In our one example on the right here, you could see Dr. Bosniak has billed 29 hours of telehealth services on one day. So that would probably be a big red flag to the government, just on pure volume. So maybe, but take a look. Maybe dates of service were wrong. You know, there could be things that may explain that. But you want to use like a gauge. So you want to maybe come up with a target and figure out what would be an appropriate use. What are the provider schedules? Are they 4 hours a day working, or are they a full schedule? And go from there as a guideline. We have our next slide. It's our polling question number 3. Are any of the discussed use cases relevant to your organization's current focus areas?
We'll give a couple more seconds for everybody to get their answers in. And with that, we'll move to the next slide. So considerations for path forward. We talked a lot about, what is the DOJ guidance, how there's so much importance on data, how data can be used, how can you have a data-driven, risk-intelligent, program. Then we talked about some tactical, practical examples on how you can utilize internal and external data in different examples. And once again, there are additional scenarios included in the appendix of the presentation, which will be available to all of you. And we request you to review and consider the things that are applicable. Let's talk about how do we now operationalize all this. So just from even the 5 samples we looked at, you can see the wealth of insights that can be generated from compliance analytics to help increase oversight of the coding, billing, and that too system-wide. But it can also get overwhelming. To Debbie's point, prioritize, think about where do you want to start first, have a clear vision, and start small bits at a time. So not only can you perform the review, leverage the insights, do your probe, but then also inform the remediation steps that may follow. And naturally, not overwhelm the system, right? So as always, you will need to assess and prioritize the analytics that are right for you and your organization. The process and the outcomes, we want to make sure that they're being utilized appropriately and timely, so that you can react rather than having something sit there for a couple of months and the next thing you know, there may be some added issues on it. So consider reaching out to relevant departments and leaders to confirm there's no overlap happening, right? Because we know our patient accounting, our revenue cycle, our clinical departments, they may be performing their own reviews, own analytics. So compliance is really there to add on and really make sure that the work that's being done is added value. And if there's an opportunity to enhance the analysis that a respective group or department is performing, that's great. And if not, it might be something that compliance can develop from scratch. Again, the goal is to avoid overlapping and duplicating of efforts, but also avoiding any gaps that might be there. So to sustain use of the data-driven approach, it will be important to create an efficient operating model that outlines compliance and business roles, responsibilities, and actions. Again, not just working in a silo or working in a vacuum, but really having a collaborative effort. And as demonstrated on this slide, we recommend you outline a process that depicts steps that are specific to your organization. Some of the steps that are highlighted here that may be key elements to consider are: one, how to collect claims data. Who do I get it from? What system? What sort of validation effort will I have to go through to not only utilize the data once, but on a recurring basis? Another step to consider is how to summarize the findings in a user-friendly reports, dashboards, have a cadence, have something that's simple, clean, and again, very easy for anyone to understand and pick up. Third, what's the process to review and analyze and share results? Will it be done at department meetings? Will it be done as part of the compliance report? Will it be embedded into a monthly review that is being performed? Think through those steps. What are the reporting channels, right? Because not all analysis will be applicable to all departments or all personnel. So what channels do need to be informed of the analysis and the results that are coming out? And then finally, in your operating model, make sure there's thoughtful approach on developing remediation plans. That includes education, monitoring, training, process improvements, and not only just to have the plan, but also a process to monitor the completion of the corrective actions and track against it. And again, it's a loop again. Once you put a new process in place or you're doing an education, you circle back and we'll have to monitor to say, was that effective? Did it really address the issue or filled in the gap that was identified? Again, in addition to these core steps, think of common pitfall that may occur. We would be remiss if we are not reminded of the saying, garbage in, garbage out, right? So the data, it's very, very important to make sure you have accurate, complete data and data that's representative of the broader universe, so that when you are reporting trends or when you're reporting insights, it's not narrowed into one specific month or area. And some may be specific, but overall, you want to make sure that your analysis is representative of the broader universe. So it's useful and it can be acted upon. No matter how good the process may be for analyzing, the data inputs need to be accurate. And we can't stress that enough. And I'm sure Debbie will talk about that as well. So again, tailor the model that best meets your needs and meets the goal and the vision that you want to accomplish. And then there are some key questions to ask. You can see at the bottom of the screen, we've put a couple of initial questions to consider. Debbie, would you like to share more examples of questions or any other considerations when it comes to operationalizing data-driven compliance monitoring?
Yeah, I think it was just reminiscent of our lean management. If a number of you are utilizing that, you really can plan if you use the plan, do, study, act, and it's just a cycle like Dara was mentioning. You do need to invest the time in that, but it really is, the benefit is it actually is less time. It makes for very effective use of your resources, focuses you, really great strategy. So this model is one to look to, and then getting everybody engaged around it. So everybody knows the expectations, what to do, but then it gives you the flexibility because you can then again go back, like Dara mentioned earlier. You have to be flexible. You have to be able to adapt and look at things, especially in our world of compliance. It morphs. Might be somebody's up coding today, and now you've done the education, things change, and a new problem presents that you need to address. So the risks constantly change. So I agree with Dara wholeheartedly. Plan, check your data, trust and verify your data, validate, and just continually, and keeping your pulse on those risks for your organization. No one organization is identical. So not one size fits all, but I think with your risk assessments, you can utilize that to focus your resources and energy on those high risks for your organization. It's very important.
Yeah. No, thank you so much, Debbie, and great points. So with that, we'll move to our final polling question for this presentation. Do you think your organization could benefit from a data-driven approach to support effective operational and compliance practices? Yes or no? We'll give a couple more seconds, and then we'll move to our final slide of the presentation. So I hope everyone had an opportunity to answer the polling questions as they are needed for eligible CPE credits. Debbie, I will turn it over to you for our final slide, and then we'll go from there.
Thank you. This is what we call, Dara and I call, our lessons learned slide, but it really gives you the framework. It lays out our three-phased approach that we've discussed today. So vision, build, and maintain. So first, aligning your vision for data analytics program to support your operations, so customizing it. Then building it, work with others, collaborate on that report building and data gathering, and execute on those activities by developing reports and dashboards. Think about what you're trying to measure. And then maintain by providing ongoing support. But be flexible because you will need to modify and think through what's changed in your organization. It is a very thoughtful process, but I think if you invest the time and think about your organization's, say, risk assessment, what are those top risks for your organization? What do you want to get out of this? And build that plan around it. You really have a great foundation for an effective data analytics program and compliance program. And then just keep plan, do, study, and act.
Absolutely.
Yeah.
There's no one size fits all, right, Debbie? I mean, we have seen that, not just within your organization, but with any of the clients that I work with. And it's all about tailoring and customizing to what you need. And what may work this year may not work the next year, right? So as you update your compliance work plan, or as you as an organization perform your risk assessment, rethink. There shouldn't be anything that's, one and done, or same approach that can work for years and years from now. Now more than ever, right? With so many changes coming up, and who knew pandemic would cross our paths in 2020. So it's more important than ever to just be proactive, do best to stay ahead of the game so you can manage any curveball that comes through, and develop meaningful and risk-based data-driven compliance program, and incorporate the lessons learned as part of the process so that it continuously improves and provides what you and your organization needs to be successful. And I believe, Debbie, this does close out our presentation, and I'll turn it over to you. But thank you all so much for joining us today. And I hope what Debbie and I have shared is helpful. And Debbie, over to you for final comments.
Yeah, just thank you once again for joining us for today's presentation. We hope you did find this helpful. The copy of the presentation will be available on the Crowd Compass app, and we will now open it up for Q&A. Please type your questions in the Q&A feature located at the bottom of your screen, and we will do our best to cover as many questions as possible, any and all. Thank you so much.